Alana Mutnick to explain, despite years of strains of emergency services, Alana, the county's new EMS system is meeting or exceeding expectations.
Yeah, John, that's exactly right. This past year, AMR met every performance standard in the county's contract. They missed no benchmarks, surpassed response times, and paid no fines in comparison to spending hundreds of thousands of fines in 2023. AMR officials say these results reflect a new contract rebuilt on intention.
And I cannot remember a time when the ambulance contractor went an entire year meeting all the performance metrics.
An influx of calls, staffing challenges, and a growing need to help the homeless, something the old EMS system in Knox County couldn't handle.
It treated the entire county, including the city, the urban areas and the rural areas, as if they were all one kind of neighborhood. So the response time requirement was one.
A new contract addresses this directly and successfully.
We had to make the literal physical improvements to service delivery, but at the same time, we had to convince people that change was actually coming.
Wesley Brookshire is a part of that change.
We had so many roadblocks growing post-COVID with hospital delays, really even down at the 418 North Broadway area that we wanted to address. So we got creative and made sure we had plans to keep growing.
Now, a county-funded clinic site at Carm.
People down at 418 North Broadway may not have that social support, so that's where we step in as AMR and try to find those resources.
And a 911 nurse navigator program, jumping from almost 500 calls to 2,500 in just 3 years.
Patients don't always need an emergency room. Sometimes the definitive level of care, the right level of care for them at that time is going to be going somewhere else that's not an emergency room.
It's a turnaround focused on innovation, accountability, and investment.
Our clinicians truly believe that. Nobody gets into this field because we want to be rich and famous. What we get into this field for is we want to provide excellent patient care.
AMR leaders say they're always looking at changes to make the system better, but the structure of the current contract is working. They've gone from a system that had roughly 15 ambulances a day to now almost 30 and no longer have to use an ambulance to transport dead bodies or hypodermic needles. The current contract is running through 2029. John.
Alana Mutnick with the update. And